So we're in the GI or gastrointestinal tract, and let's go. So foundational concepts. So the importance of anatomy of this GI system. So it's crucial for a shared mental model. So reducing surgical injury risk, informing clinical decisions, and enhancing patient safety overall. And that's, I think, one of the uh, importance of knowing all the anatomies, not only this one. So next is abdominal topography. So the abdomen is divided into four quadrants: the right upper quadrant, left upper, right lower, and left lower, and nine regions: epigastrium, umbilical, and iliac, left and right. Uh, and then it's your task to look it up. This is just a review. And next is embryology and blood supply. So first is the foregut. So this forms the stomach and the first part of the duodenum. So that's the foregut, and it's supplied by the celiac axis. Next is the midgut. This forms the small bowel and colon up to the splenic flexure, and it's supplied by the SMA or the superior mesenteric artery. And lastly, it's the hindgut. Um, so this forms the distal colon and upper anal rectum, and this is supplied by the inferior mesenteric artery or the IMA. And this proctodeum, this forms the lower anal rectum, and it's supplied by vessels from the internal iliac arteries. Next is the peritoneum, omentum, and mesentery. First is the peritoneum. This is a serous membrane lining the abdominal cavity, and is divided into the greater and lesser sac. And next is the omentum. This includes the lesser omentum um, in the liver and stomach, and greater omentum which hangs from the stomach. And mesentery. This is a double layer of peritoneum connecting the intestines to the posterior abdominal wall, and it's now considered a single continuous organ, and it serves as a conduit for vessels, nerves, and lymphatics. And this is a very interesting research that's ongoing at the moment. Next is the nervous system of the gut. And this is the ENS or the enteric nervous system. This is the gut brain. I repeat, the gut brain. Yeah, this is capable of independent action, and it comprises in two main plexuses: the myenteric or Oberback's plexus, which controls gut motility, and the submucosal or the Messner's plexus. This regulates secretions and blood flow. So Oberback, this controls gut motility, the moving of the gut. And this is the myenteric. So motility, myenteric motility. And its surname, Oberback. So that's the Oberback's plexus. Next is submucosal. So submucosal and mucosal, mucus secretions, submucosal secretions, and blood flow. So Meissner's plexus. And then this is a very good thing to remember, which is the gut brain axis. This is the complex communication pathway between the ENS or the enteric nervous system and the central nervous system. So that's the gut brain axis. Next is visceral pain. Pain from the abdominal organs is often referred to the areas. For example, gallbladder pain is referred to the scapula. So that's visceral pain. If you have pain in the gallbladder, you can feel it in your scapula. So next time you're inside your clinic and then they're referring to scapular pain, make a pathology from the gallbladder one of your suspects. So next one is organ-specific anatomy. So esophagus. So in Barrett's esophagus, normal squamous lining is replaced by columnar epithelium, which is the intestinal metaplasia. Next is the stomach. It contains parietal cells, which secrete hydrochloric acid and intrinsic factor, very important. Next is the chief cells. The chief cells secrete pepsinogen, and the G cells produce gastrin. And then the proton pump, which is the H plus and K plus, so hydrogen and potassium and ATP is the target of proton pump inhibitors. And then H. pylori is the primary cause of what? Gastric ulcers, the H. pylori. Helicobacter pylori. Next is the small intestines. Its features, villi and microvilli, is their distinct characteristic, which increase their surface area for absorption. Next is large intestine. So this is characterized by haustra. Haustra. And this is the marginal artery provides important collateral blood supply in the large intestine. So the appendix is the uh, most commonly seen in the retrocecal position. So let's continue in the gastrointestinal accessory organs. So first is the liver. So it is located in the upper right quadrant or right upper quadrant of the abdomen, inferior to the diaphragm, and it is divided into a right and left lobe. And it is divided by the falciform ligament. In urological surgery, this is the it's very important that we do not hit this with our suction port. So this is the falciform ligament. And the liver is further divided into 8 functional segments based on Cunard's classification, each with its own vascular inflow, outflow, and biliary drainage. So 8 lobes by the liver. Next is the gallbladder. It rests on the inferior surface of the liver. It consists of a fundus, a body, and a neck. And you can really appreciate this in robotic surgery, which I'm very fortunate to be a part of. So when we do gallbladder surgery and cholecystectomies or liver resections, you can really appreciate where the gallbladder is. Next is the pancreas. This is located retroperitoneally with its head nestled in the C-shaped curve of the duodenum and its tail extending towards the spleen. The very elusive pancreas. And then the spleen, it's situated in the left upper quadrant and related to the stomach, and the tail of the pancreas and left kidney. So when we're doing renal or kidney operations, sometimes we see the pancreas, which we avoid at all costs. So and the spleen, yeah, we avoid those at all costs. And next is the duodenum. So this is the first part of the small intestine, and it's divided into 4 parts. It has important anatomical relationships with the liver, gallbladder, and pancreas. For instance, the head of the pancreas is closely associated with the second part of the duodenum, where the common bile duct and pancreatic duct unite at the duodenal papilla. So that's where it unites and where the juices get secreted. And let's go to the blood supply. So the hepatic portal venous system. So the liver receives a dual blood supply. So the portal vein brings nutrient-rich deoxygenated blood from the GI tract, spleen, and pancreas, and the hepatic artery supplies oxygenated blood. And then the venous drainage from the liver is via the right and left hepatic veins into the inferior vena cava. And let's talk about portal hypertension. Now, this is a condition of high blood pressure in the portal venous system. That's the name, portal hypertension. And this is often a complication of cirrhosis. And this is when really you can see the liver damage. when you see it in the inside a laparoscope. Next is celiac axis. Now this is a major branch of the aorta that gives rise to the common hepatic artery, splenic artery, and left gastric artery, supplying the liver, spleen, stomach, and pancreas. So that is the celiac axis. Next is the biliary system. So the bile production and flow. So bile is produced in the liver and travels through the series of ducts. The intrahepatic ducts merge to form the right and left hepatic ducts, and which they unite to form the common hepatic duct. So intrahepatic ducts merge to form the right and left hepatic ducts and unite to form the common hepatic duct. And the cystic duct from the gallbladder uh, joins that duct to form the common bile duct. And what's the function of the bile? So it aids in the digestion and absorption of fats by emulsifying large fat globules into smaller droplets. So gallbladder function, it stores and concentrates bile, and it releases bile into the duodenum in response to the hormone cholecystokinin, or CCK. Now let's go to the pancreas. So it has two functions, exocrine and endocrine. So exocrine and endocrine. So acinar cells secrete digestive enzymes like pancreatic amylase. So this is for carbs, pancreatic amylase for carbs, lipase for fats, proteases for proteins, and nucleases for nucleic acids. So I think you can see the correlations there. So amylase also secreted in your saliva. Amylase is for carbs, lipase, lipo for fats, proteases, proteins, and nucleases, nucleic acids. Next is endocrine function. So pancreatic islets secrete hormones, so insulin from beta cells that lowers blood glucose, and glucagon from alpha cells, which raises blood glucose, and somatostatin inhibits both. The last one is the hormonal control in the duodenum. So secretin, it stimulates the pancreas to release bicarbonate to neutralize stomach acid. Because as you know, the chyme, after it exits the stomach, you could imagine that the acids are still there, and of course secretin would help it neutralize the stomach acid. So next is cholecystokinin. It stimulates the gallbladder contraction, pancreatic enzyme secretion, and inhibits gastric emptying. And next is gastric inhibitory polypeptide, or GIP or GIP. This inhibits the release of gastric secretions. Now these all work in correlation in your digestion. Now if you found this video helpful, and of course, I urge you to do the multiple choice quiz and review the essay questions to further enhance your knowledge. If you're here for the first time, please do consider subscribing, and comment down below if you would like some more topics to be covered, which we will endeavor to do. Okay. Alexa was saying something. So I'll see you in the next video, and consider liking and subscribing, and yeah, do the multiple choice quiz just to test your knowledge, and I'll see you in the next video.